When you hear about plastic surgery, it's often about celebrities who maybe took it a step too far. But a facelift can be something that really helps your overall appearance. Joining us is Dr. Glenn Lyle from the Raleigh Plastic Surgery Center. Nice to see you, Dr. Lyle.
Thanks for having me.
Facelifts, they've been around for quite some time, and you always hear about it from celebrity-wise. But tell me really, what is the basics of a facelift?
Basics of a facelift, essentially what the area that the facelift is best for is the removal or the improvement of the jowls, which is the sort of the hound dog appearance.
Right.
And the neck.
So this right here, this woman had, geez, this is a remarkable difference.
Yeah, this is a woman about 56 years old and just felt a lot younger than she looked, and she just wanted an improvement in the jowl and the neck. And you can see I always feel like a facelift really it includes a neck lift, and essentially when you do a facelift, you're pulling back skin and you're repositioning some of the superficial muscles underneath the face.
You're actually moving muscles too.
Some very superficial ones, not major facial expression muscles, but there's a thin layer of muscle that supports the skin, and we tend to either tighten that or rearrange that to improve the results, and just makes a dramatic improvement. A lot of people think, oh, it's just for wrinkles. It really doesn't necessarily help some of the wrinkles, like around your mouth or even these areas in here, but it's really excellent for the jawline and the neck.
And sometimes too, like with this woman here, you say, she has the laugh lines per se, but it's actually, that's part of the character of her face, and that did not disappear, but it improved. Right,
and I think people want to look refreshed and want to look younger. They don't want a totally different look. They want to preserve. A lot of people bring in pictures of what they look like when they were younger, and they want to look like that again. They don't want to look like someone different, which is why sometimes when you see so-called bad plastic surgery, it makes people look different. And, and that's, you try to avoid that.
So you counsel your patients in the consultation about what is realistic?
Yeah, what's realistic? I mean, you can pull back as much as you want, but you don't want to have an unnatural look, and you want to try to it's not so much about take more skin, that's better. It's really positioning the skin, positioning it in a higher, back to where it used to be, where sort of gravity has taken over.
Now, what is the difference between a facelift and a mini facelift? Because I looked on your website and you have a couple of patients with before and after pictures that actually have a mini. What does that mean?
A mini usually is better for people that don't have a lot of neck problems, and where it's really the cheek and the jowl that is starting to fall. It's usually a younger woman, not always, but a younger woman, maybe someone that doesn't want to have as much surgery. The extra incision from the ear back is twice, the entire incision starts in front of the ear, goes up into the scalp in most cases, front of the ear and then back. The mini does not use the back one, so you really don't address the neck. So it's not good for some people who have loose necks. And it's people that, it's usually a younger patient, maybe someone that doesn't want the downtime. Sometimes people say mini facelift, mini result, so you got to be careful. If you really need a facelift, I'll tell you, don't go for a mini just to kind of save money or save
because
time.
Then she or he may be coming back in 5 years' time saying, I'm not happy, or less.
Even less.
Now, if you do a full facelift, what is the expectation as far as length of time that it lasts as you age? Right,
and that's a very good question. People always ask that. When I was in training, they used to say, oh, it should last you 10 years. Well, your face ages differently, and some people, it may last 5 years or 6 years or 8 years. I would say the average lasts about 8 to 10 years.
But of course it's very subjective. What does last mean?
Right. I mean, there are people that come back a year later and say, hey, can you tweak this? Can you pull back a little bit more here or something like that? And it depends on your lifestyle. If you, a lot of sun exposure can increase the sagginess. Some of it's genetics. The other thing too is, it costs a fair amount of money, so people aren't ready to plunk down the same amount of money in 6 years or 7 years. So it may be that they've finally gotten to the point where at 10 years they want another one. It's not real common for people to have more than one facelift. Depends on when you had it. If you had it very early, you know, if you had it in your 40s, if you're that concerned about yourself at 40, then it shows that you're aging maybe a little bit more rapidly, and maybe you will need one when you're in your 50s. But most women are in their 50s when they present. That's sort of the average time.
Now, the statistics, are these true that there are more men seeking plastic surgery now than ever before?
There are. There are more men. I will say that facelifts, it's unusual to have what I consider a good facelift on a man. That's not to discourage men from having it, but if you ever see, men tend to age, and it's not really fair.
I know. I was just going to say, just say it.
Well,
better.
Men, yeah, well, not necessarily. I think we're more accepting of.
Yes, absolutely.
You know, women wear makeup. Women, you know, put their hair in different styles. Men don't do that. So when you see a man, and there are some notorious examples out there of having eyelids done, facelifts, they always look weird.
Well, our vice president, not to say anything too bad, but it was pointed out that he had a brow lift or something.
Right.
And he did look quite different.
Right. And it's hard, and I'm not saying it's difficult to get a man to look as good in a facelift. So.
And frankly, I think our society and our culture has lent itself to say that men are actually more attractive with a little bit of gray, with a little bit of character, right?
Right, right. And usually men, it's the neck, you know, as we were talking about the neck. They really, you know, the neck gives away your age. And so they want the neck lift more frequently than a full facelift.
Got it.
But a lot of times you can't just do a neck alone. You have to do it with a facelift.
Some other things. Okay.
Right.
Very interesting. Thank you so much, Dr. Lyle.
You're welcome.
If you'd like some more information, plus to see some of those really excellent before and after pictures, just visit our website at mycarolinatoday.com, and you can check out Dr. Lyle's site. Thanks again.
Thanks.
As the weather warms, more people head outdoors, but the danger of melanoma lurks. Dr. Glenn Lyle with the Raleigh Plastic Surgery Center joins us now to discuss the dangers and what happens after you've been diagnosed. Thanks so much for coming in.
Glad to be here.
Now, of course, you are a plastic surgeon, but you see a lot of patients who the dermatologist may have referred to you because of skin cancer.
Yeah, it's a pretty good part of my practice. The dermatologists are usually the ones making the diagnosis of the skin cancer. They usually do the biopsy and confirm it. And when they're a little bit more difficult, maybe a larger removal, maybe something on the face or something a little bit more cosmetically concerning, usually a plastic surgeon will do the removal of the skin cancers.
There are lots of kinds of skin cancers. What do you deal primarily in? What's usually so severe that they need to come see you?
Well, the three main types of skin cancers are basal cell cancers, which are the bottom layer of the skin which gets involved, and that's usually kind of a pearly little lump that comes up. Sometimes it bleeds, sometimes it has a trouble healing. Those are very common, and sun exposure is one of the risk factors. The other type is squamous cell, which is really the top layers of skin that develop, and that's more of a scaly type of a lesion, maybe crusty. And then melanoma, which is the worst of the three because it has much higher rate of metastasis or spread. It can spread, and it can actually have a significant mortality rate. And unfortunately, all three of those types of cancers can affect people from all ages. Melanoma can actually affect even younger patients, and unfortunately, if not caught early enough, can ultimately lead to your death.
I know several people who have had skin cancers in their 20s and 30s. Well, we go through this every summer, but let's remind our audience what they need to look for, the warning signs, and how they can prevent cancer in the first place.
Right. I think in general, just checking your body, looking at moles that you have, any new moles, a mole that's changed, or even a new spot. Sometimes they're in places you can't see, like the back.
Now look at this, the video we're seeing now. Are these the types of moles that should be concerning?
Yeah, anything that has, typically, you know, a lot of us have moles that kind of stick up, and you always worry about those. But actually the ones that are just sort of brown appearing and stick up, come out, and maybe they're ugly, those are not the ones we worry about as much. It's usually the flatter ones. The ones like in this picture has an irregular border, maybe some irregularities of the pigment, little black spots in the field of a brown pigment. pigmented area. So in terms of melanoma, those are the things you worry about. Maybe if it has a symptom, usually they're not symptomatic though. They don't hurt and they don't bleed necessarily, at least melanomas. And they can be found on other parts of the body that you never look at. You can't see